Good morning. I'm Dr. Tom, and we're going to be having a prequel today of our KSRO Ask the Expert show tomorrow. And we're going to be talking about what to do when you have to wear a mask. So, unfortunately, we're all in a shelter in place because of the COVID-19 pandemic. And now we're starting to get out a little bit more in some areas. But certainly it has been recommended in Sonoma County, it's actually been ordered in Sonoma County that we have to wear a mask when we're in a public area. And in Napa now they are strongly recommending that. That's the latest from our public health departments. So we're going to be walking around with masks. It's interesting. I go out for a walk and we've all been in shelter in place, and so I take my dog and I wave to maybe a neighbor who's walking by or somebody I don't know on the other side of the street. We're keeping safe social distancing, and we smile, we wave, maybe say hello, how are you? And it's a very nice interchange, and it's that human interaction that we really, really need. And so that's been the really nice thing about being able to go out for a walk. Now I'm going to go grab another mask. And now we have homemade masks, and we have masks like this. A little bit darker. And I noticed that the interaction was completely different. And in fact, as people walk by, they kind of didn't even look at you in the eye. There's a sort of a disconnect as we cover part of our face in terms of our interaction. So that was a little muffled. There's a little bit of a disconnect when we interact with a larger mask or a dark mask across our face. So what do? How do we interact with people? How do we emote positivity, friendliness, warmth? Well, I've been working with a mask in surgery, geez, if you count my medical school years, for 35 plus years or more, and certainly in surgery for 30 years. We certainly communicate by talking, by directing, by hand gestures, but we also communicate with our eyes. So really, that's where the communication comes from. And it's interesting though, we can tell when someone is smiling, or when someone's surprised, or when somebody is maybe very serious and focused with a mask on. Okay, and it's always interesting a lot of times working with operating room staff that sometimes we know them more by what we see in their eyes than when they have their mask off. So what do I recommend for our patients, for you in the public, as we are all now donning masks? We're all donning masks to protect ourselves and to protect our public, our fellow human beings. What is it that we can do? Well, it's in the eyes. We've said that the eyes are the windows to the soul, and I believe that is actually true. So one of the things we want to do is we want to frame the eyes. That's going to be really important. We want to frame our eyes as if they're pictures. Okay. So one of the things that we have to do is we want to give it a nice frame, is we want to support underneath the eyes, even with the mask on. As you see the mask here on me and where it sits, this area right underneath our eyes is exposed. So as we get older, or for some of us, especially if you're very athletic and lean, and this area is deflated, it tends to allow the light, which is usually from above, sunlight or fluorescent light, like in my home studio here as we're filming for our shelter-in-place broadcast. The light comes down, hits on our eyes, and bounces down. Okay. So we notice that when we smile, even with the mask on, what happens is that we bring our cheeks up. The light now comes down and hits our cheeks, so our cheeks come up. The light comes down and hits our cheek. The reflection pad now has been changed from flat to more of a curve, so it hits here, and it bounces up into our eyes. That's why when many of us smile, we get a twinkle in our eyes, and that's as we bring our cheeks up, even though our eyes tend to scrunch a little bit when most of us smile, unless you're a professional model who learns how to smile with their eyes open. I don't know how they do that, but most of us, we tend to squint our eyes down when we smile. Okay, so we want to build up this area. So one of the best things to do in that area is using filler. And so adding filler in the infraorbital area is key. But It's interesting that I presented this about 4 times in national and local California cosmetic surgery meetings, talking about a study that was done by the American Board of Cosmetic Facial Surgery, that they polled these cosmetic facial surgeons about where they would like to put filler, and in particular in the infraorbital area. And we're finding that less is more. Initially, like with everything, we like what we did in an area that we've treated. Then we get a little bit too exuberant, or the patient demands more, and we start to try to overfill this area. And then it begins to look lumpy or puffy or unnatural. And so now we're kind of swinging back to where we know that a little bit goes a long way in the infraorbital area, maybe half of a syringe under each area. But what I do as well, and has been confirmed by these studies, is that right here, I call this the money spot, which is on your cheekbone. It's for those who are anatomically oriented, the area of the zygomatic and maxilla junction right here. And that by feeling right in this area here, this helps to support the infraorbital area. And so putting filler in this area can be very beneficial in improving that reflection pad, allowing the light to hit that area, even with the mask on, and to reflect up into your eyes, to get that sparkle in your eyes. Okay, so that's going to be important. Another area that is of concern is the frown area. And so it's really basic. We all, if you've been following cosmetic medicine and aesthetics for a long time, we all know the wonders of Botox. Okay, so we can walk around looking very concerned, frowning, maybe looking even angry, and it's causing these frown lines here. And what that does is it brings the eyebrow down and it emotes anger, okay? Or it emotes stay away, or I'm not approachable. So what we want to do with the mask on is we want to open up your eyes. We want to open up your eyes with the mask on. So Botox in the, what we call the glabellar area, and in terms of treating the procerus and the corrugator muscles here, is that by softening that movement, we will take away that look of anger, of concern. We will actually open up our eyes. We get a compensatory lift on the outer aspects of our eyes. And it's particular for women. They love that because the arched eyebrow is a very attractive eyebrow. Okay. For men, we tend to want them to be straighter. That's a little bit more of a masculine look. And so there are some nuances that we do when we inject Botox in men, where we may inject right in here. We may do a little bit less in the tail of the corrugators, and that's for us who perform the procedures, where we may put a little less in one area. And then we may add a little bit more out here on the sides to drop our eyebrows down. Now, for the most part for women, I tend not to like to inject up here if I can, because I like to get the arch of the upper eyebrows or the eyebrows for women. It's a very nice, attractive look, and it opens up the eyes. Another area that we can treat is actually at the tail of the eyebrow, right here. We have a muscle right here that's called the orbicularis oculi, okay? But it tends to do this. So it creates the smile lines. So certainly injecting Botox or Dysport, which is the other Botox that we carry in our office, Botox or Dysport in this area right in here, that will help to soften the crunching of the eyes, okay? Especially for me, and I'm Chinese and Greek, okay? And so I like to try to open up my eyes as much as I possibly can, just because genetically of my upper lid hanging down a little bit lower. I like to get this area right here injected, right there, which helps to open up the eye a little bit more, okay? Also, injecting in the crow's feet area helps to soften the scrunching down on the outside, or what we call the lateral aspects of the eye, to open them up as well. And those are the areas that I have treated just typically when we're not in a pandemic. And if we're able to go to my office, that's what I would have done. I would have treatment of my frown lines, my smile lines, and just a little extra in the tail of my outside eyebrow, in the tail of my outside eyebrow, to get a little bit more lift to open up my eyes, okay? So that's important. That's very important in terms of opening up our eyes to make us seem welcoming, warm, okay? Especially if you tend to have maybe smaller eyes or Asian eyes like I have, not enough Greek here in these eyes, mostly Asian. We tend to have the lids down a little bit lower. Botox, especially on the outside, makes a huge difference in opening up your eyes. And that's going to be important because what do you see when we have a mask on? What do you see when we have a mask on? You see the eyes, okay? So that's part of the framing. Lastly, and this is going to be more for advanced injectors, okay, is injecting filler underneath the eyebrow here. It's interesting, by just injecting a little bit of filler directly under the eyebrows along this area right here, along the path of the eyebrows, this actually raises the eyebrow up a little bit, and it actually pulls the lids up a little bit. And we're talking a millimeter. But that can make a big difference, especially when that's the area that you're focused on when you are conversing with someone, interacting with someone with the mask on. All right, so those are little tricks that we can do. Some of us, because we're frowning, maybe we're older, we have a heavier brow, our brows tend to be low like this. And right above our nasal bone, right here, we have a little bit of an opening, or not an opening, but excuse me, a little bit of an indent in the supranasal area right there. And that's a very advanced, because it can be a dangerous area to inject, okay? So you really want somebody who's extremely experienced and extremely cautious, okay? Putting a little bit of filler here can actually push our brows up and open up our eyes as well. When I do fat grafting, that's an area that I find to be key. I love to put fat in that area because it just gives you a little bit of a mini eyebrow lift. And it's a great technique. So we can do that with filler as well. Now, one of the areas that people a lot of times will come in and want to have treated, and I tell you, it's the toughest area in terms of treating patients with Botox or Dysport, is the forehead or the horizontal lines, okay? And especially women, not so much men, especially women, they, oh, I don't like these. Can you please treat those areas? And I always have a little bit of a sigh, like, oh, because I know that I have to have this conversation, which is a little bit complicated in discussing it with the patient. All right, so these lines that you see on my forehead are related to our frontalis muscle that pulls up like this. Okay, so if we treat this area with Botox, we soften that frontalis muscle movement. We can't lift our eyebrows up as much, but we certainly can soften or even get rid of those horizontal lines for our patients. Okay, so many patients like that. But I have to say that it tends to be the younger patient who still has a lot of volume around their eyes are nicely framed because they're still young, that you can treat these areas a little more aggressively. In older patients where we have deflation in this area as well as our whole face with aging, when we treat this area, the frontalis muscle, to get rid of the horizontal lines, I will tell you that many patients will say, I'm glad that my lines are gone, but I feel like my brow is heavy. I feel like my eyebrows have dropped. So you'll notice that on me, who can get Botox or Dysport anytime I want, go to my office and have one of our great nurse injectors inject me, why do I put up with these? Well, I mentioned again, because of my phenotype, my ethnic phenotype of being Asian, I need to be able to raise my eyebrows, okay, to open up my eyes, okay, and especially when I'm communicating with you, to be able to lift up my eyebrows, surprise or joy, whatever that might be, I'm able to move my eyebrows up a little bit more. So I specifically, during this time when we're all wearing masks, would say, if you can handle those horizontal lines, don't treat that area with Botox or Dysport, because that's part of the dynamic movement of your eye. We don't really need to have a frown, okay, but being able to open up our eyes wide, happiness, I think that's really important. So that would be an area that I would tell you to not treat while wearing a mask during this pandemic time, okay? So we've talked about filler under the eyes, filler in what I call the money spot in the cheek area to help to support underneath area of the infraorbital area of the eyes. The very advanced areas would be filler under the upper eyebrow to lift it, filler just above the nose to kind of lift up the brow as well. And then talking about Dysport and Botox for our frown, our crow's feet, a little bit of extra Botox or this part right at the tail of our eyebrow to lift up our eyebrow. Okay, so that's going to be important. Now, one of the latest, I think, crazes, and I think it's actually great, is not PRP, which we talked about in the past, which stands for platelet-rich plasma. I call it the paramedics of the body. They have a lot of healing factors, growth factors. They may stimulate, it's not a stem cell transplant, but they may stimulate along those pathways for regeneration. And we like to use it on various laser treatments. I use it in mixing it with fat for fat transfer to the face and other areas of the body. Certainly after laser procedures, putting it on the skin, after microneedling, it works great. But what we're finding is that there is sort of a PRP, if you will, on steroids called PRF, platelet-rich fibrin. So what we're doing is taking that PRP, or that layer, that very fine layer of serum. So the blood is drawn, like going to a lab, spun down. We take the area that's rich in platelets and all these healing factors, growth factors, the paramedics of the body. But then there's a next step. With that, we then activate it. And it can be with a calcium-like product in a test tube, back and forth between test tubes, and it activates it. So it activates the cascade of the platelets. The one caveat is for us injectors that we have to move a little bit more quickly because it's going to lay down a little bit of clot. But that's good, okay? So what we'll do is we'll lay it down in the infraorbital area. We'll mix it with our filler, our hyaluronic gels, and so it will actually improve the texture of the skin, especially this thin skin in the infraorbital or under the eye. We will also extend the longevity of the filler. So it's a twofer, if you will, a 2-for-1 in terms of improvement of the skin, as well as extending the longevity of the filler. So we've talked about what we can do that's a little bit invasive in terms of fillers and neuromodulators, Botox and Dysport. What can we do for the skin? So that's going to be important. So I'm going to grab a few items. And this is our #1 favorite with many of our staff. And that is our Skin Better eye cream. And this is one that I actually like to use myself, and right underneath our eyes in this area here. And I also put it in the crow's feet area and on the upper lid. And it's based on polypeptides, which helps, has a lot of healing antioxidant type of effects. And it definitely can help to plump up the skin and to smooth out these areas, okay? So it's not laser resurfacing, but it certainly can help. All right. Another favorite that I use as well is the Abaji Elastoderm. And this is the facial cream, but we also have for the eye serum, which has, again, ingredients which will help to smooth out, hydrate the skin, which is really important in this thin layer right here underneath the eye, which is very sensitive. So that's going to be important. I don't use makeup, but our lady nurses do, our female nurses do, and they really like our Color Science Total Eye Care, a 3-in-1, and they really like this. They feel that does a nice job at mineral makeup, helps, so it's very healthy using it on your skin, and it helps in terms of environmental exposure, and they really like the way that it covers up maybe some imperfections in the eye area. And again, we are trying to emphasize our eyes as we wear a mask. All right. And then finally, eyelashes. I have to say now, because we've been in shelter in place for about a month, then many women are not able to wear their false eyelashes, so those come off. Okay. Don't get me wrong, I have a lot of patients who are actually eyelash artists, and I think they look great. However, just like with anything, lip fillers, breast augmentation, buttock fat transfer, we do a little bit that looks great. And then society, physicians, the patients, the nurses tend to go a little bit overboard. And then we go bigger, 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 okay, and just with the eyelashes, unless you're a show person, really, really long. And there can be that critical length where if you go a little bit longer, it actually hides your eyes, okay? And remember, that's what you're seeing now. So I like, it's on my own personal opinion, but again, we always do what the patient wants. It's not about us, it's about what the patient wants. But I actually like eyelashes that are enhanced, but not overdone. If you want the longer ones, well, certainly longer eyelash extensions work. But what can you do if you're not able to get to your eyelash artist? Well, there's a couple of things. Latisse. Okay, Latisse is a medicine originally developed for glaucoma. And Latisse helps to stimulate the growth of your eyelashes. Okay, you put it on with a little brush, and it's, in my opinion, still considered the gold standard for medical enhancement of eyelash growth. And in fact, I've spoken to many eyelash artists who actually recommend Latisse because they feel it helps to strengthen the hair where the false eyelashes are applied. So that's good to know. If you don't like medicines, or maybe you have sensitivities, then we work with a compounding pharmacy and developed our own line, our Dr. Tom line, and this is a Dr. Tom eyelash enhancement, and it helps to stimulate your eyelashes, strengthen your eyelashes, and many of our patients actually like the effect of our Dr. Tom eyelash serum. So in summary, we're now walking around shelter in place, or we're getting to get out a little bit in public, but we're supposed to have a mask on. Mandated in Sonoma County, highly recommended in Napa County, where we have offices as well, and in Maui. Okay, we also have an office in Maui. And masks are becoming probably the norm for the next month or two, is my prediction. So we want to enhance our eyes, okay, because that's where we're interacting. We're actually interacting with from the mid portion of the face to our hairline. So it's the eyes and the forehead. So we want to emote positivity, warmth, bringing people in. So Botox or Dysport for the frown area, the crow's feet. The little key here is right at the tip of the outer eyebrow area to open up the eyes more. Caution, try not to have Botox or Dysport in the horizontal lines during this pandemic time so that you can lift up your eyes, show a little bit of more emotion when you have a mask on. Then we want to support the eyes. We want to frame it. That was the first thing we talked about. And what we'll do is we're going to use filler and PRF, platelet-rich fibrin, under the eyes. We're going to go ahead and build up the cheek area, which helps to support that structure. Filler under the eyebrow, very advanced technique. Only certain injectors should be doing that, as well as just above the nose or the nasal hole. Okay, so that's it. So the eyes have it. I want to wish everybody a very safe and healthy shelter in place. I can't wait to see all of you. Can't wait to see our patients. And maybe it's going to be months from now when we can give them a hug. When you come in to see us, I don't know. We probably, I believe in Sonoma County and in Napa, are going to have to wear masks when we see you. So we'll be smiling with big smiles on in our mouth when we see you. But hopefully you can see the twinkle in our eye and the smile in our eye, the twinkle in our eye, the smile is in our eye from all the things that we're going to do to enhance them. So thank you very much. Appreciate you checking in with us. And again, you can also check in on KSRO Ask the Expert for the actual radio show that is recorded.